not responding.
Okay, help, I need some help.
So help is on its way. So baby is not breathing.
Okay. Miraculous.
So there are no signs of life and there's no pulse. So 1 minute is up. Okay, so I'll stop you right there. Okay. Well done, Angie. Let's do stage 2 now.
Okay.
So let's explain what we're doing in detail.
Okay.
Okay? All right, so same scenario.
All right. Okay. I want to assess for my safety, the child's safety, is it safe to approach?
It's safe to approach.
Okay. I want to stimulate the child in a safe but appropriate manner. Baby, can you hear me? Baby?
So baby is not responding.
Baby is not responding. I ask for help. Help, please.
And help is on its way.
Okay. So I go on to assess to ensure a patent airway. So I perform a head tilt chin lift maneuver into the neutral position. This is an infant. Do a quick check into the airway to make sure there's no obvious foreign body. Is the airway patent?
The airway is patent.
The airway is patent. I proceed to assess for normal effective breathing. So I will look for chest rise or normal movement. I will listen for airflow at the nose and mouth. And I also feel for airflow at the nose and mouth for not more than 10 seconds.
And when you do this, you don't feel anything, hear anything, or see anything.
So in the absence of normal effective breathing, I proceed to deliver 5 rescue breaths, appropriate size mask, with appropriate placement, C grip chin lift, and C and CE grip. I'm going to ensure that I deliver 5 effective breaths, C adequate chest rise, delivering breath over 1 second. Not too much, not too much. After 5 inflation rescue breaths, I proceed to assess for circulation. So I'm going to assess for a central circulation, central pulse, as well as signs of life. This is an infant, so I'll feel for the brachial pulse. Feel for signs of life, which includes coughing or vocalizing, crying. And I do this for not more than 10 seconds.
And when you do that, there are no signs of life and there's no pulse.
Okay, in the absence of a pulse or not an effective pulse, no definite pulse under 10 seconds, I proceed to position for my chest compression. So zippy sternum, a finger breadth above that. I use 1 or 2 fingers. I'm going to apply chest compressions vertically down across the sternum. I'm going to do this at a rate of 100 to 120 compressions per minute. And I want to give 15 cycling with 2 breaths. I'm going to compress the diameter, a third of the AP diameter, or around 4 centimeters for an infant. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. When I give those, I'm going to ensure that I have adequate recoil or relaxation. And I proceed to give 2 rest breaths. I will continue this cycle, ensuring that I always position at the right position over the zippy sternum.
1 minute is up, Angie.
After 1 minute, I want to reassess, and I do a quick reassessment of all together. So I'm going to ensure my airway is patent, look, listen, and feel for a set of breath, sound, and feel for a central pulse as well, all at the same time.
Thank you, Angie. I'll stop you there. So that was the infant.
Okay.
Okay, let's move on to the child now. So I have another scenario for you. In this one, you're walking through the pediatric emergency department and you are called by somebody who's sitting in the waiting area and they show you that a 6-year-old boy is lying on the floor. Again, there's no suspicion of trauma. When you approach the child, he's motionless, cyanosed, and has mottled skin.
Okay, 6-year-old boy found motionless in the play yard, no history or suspicion of trauma. I approach, he's motionless, mottled skin,
And cyanosed.
And he's cyanosed. Okay.
Okay.
Is it safe to approach?
It's safe to approach.
Okay. Can you hear me? Can you hear me, John?
So baby is not responding.
Help? I need some help.
Help is on the way. So the airway is patent. And your baby is not breathing. So there's no pulse and there's no signs of life. So 1 minute is up. Okay, and I'll stop you right there, Angie. All right, so shall we do this with stage 2 now?
We can.
Okay. So same scenario.
Okay. Assess for my safety and the safety of the child. Is it safe to approach?
It's safe to approach.
Safe to approach. I stimulate the child in a safe but appropriate manner. John, can you hear me, John?
When you do that, John doesn't respond at all.
Okay, he's unresponsive. I ask for help. Help, I need some help.
And help is coming.
Okay, I proceed to ensure patient airway. Head tilt, chin-lift maneuver into a sniffing position with the child. Looking into the airway briefly to check that there's no organ foreign body. Is our airway patent?
The airway is patent.
Airway is patent. Then I proceed to assess breathing. I'm looking for normal effective breathing. So I will look, listen, and feel for not more than 10 seconds.
And when you do that, there's no breathing that you note.
In the absence of normal effective breathing, I proceed to give rescue breaths, 5 rescue breaths, ensuring the chest rise with each inflation. After 5 rescue breaths, I proceed to assess my circulation. I will feel for a central pulse, a carotid pulse here for a child. And I'm also looking for signs of life for not more than 10 seconds.
And when you do that, there's no pulse and there's no signs of life.
Okay, so I proceed to landmark for my chest compression. Defeat sternum, my finger breath above. I'll use the heel of my hand to this child. And I'll proceed to give 15 to 2, 15 chest compressions. Adequate chest compressions, ensuring adequate recoil between 7, 8, 9, 10, 11, 12, 13, 14, 15. Ratio of 15 to 2. Continue this for about a minute.
And a minute is up now.
Okay. Then I will now reassess the child. And so, airway, breathing, and circulation all at the same time. A quick check.
So the airway is patent, your baby's breathing, and there's a pulse. Well done, your baby's alive.
Thank you.
So we'll move on to the conscious infant choking. Okay? And I shall pretend to be the mommy. So a friend's baby starts to choke after sitting up in a high chair and feeding herself with sausages.
Okay.
You passing by, you see that the baby's having difficulty breathing, and you decide to intervene.
Okay. A child infant is eating sausages, choking, and I appear to see, I find that they seem to be having difficulty breathing, and I approach. Okay.
Okay.
All right. Is it safe to approach?
It's safe to approach.
Okay.
Oh my God, save my baby!
Mommy, can I have your baby, mommy? Okay. So the baby is conscious, is responsive?
So the baby is actually trying to cough, but it's an ineffective cough.
Okay. Help, I need some help.
Help is coming. Someone has called 911. Yay, it's out. Okay, thank you, Angie. Shall we do that in slow motion now?
We may.
Okay, so same scenario. Baby who is feeding herself sausages and is trying to cough ineffectively.
Okay.
Okay.
So I assess my safety, the safety of the child. Is it safe to approach?
It's safe to approach.
Okay. stimulating or assessing responsiveness, consciousness and effectiveness of a cough. The child is conscious, coughing but not effectively. They ask for help. I proceed to, I want to place my baby in prone position, head down, ensuring that I hold the chin, thumb and finger or two at the angle of the jaw, avoiding the soft tissues. Put them astride over my arm, and I'm going to deliver 5 back blows. Each back blow is designed to dislodge the foreign body. That's 5.
Okay.
Those 5 are ineffective. I carefully sandwich and turn over into supine, head down, and proceed to deliver chest thrust. Do the same. 5 of them. Effective. 2, 3, 4, 5. After this, I haven't dislodged the foreign body. I quickly reassess for consciousness and foreign body out. Baby still conscious, still an ineffective cough. And I go prone again, head down, and once again deliver back blow.
Yay! All out. So in this scenario, I'm sitting in a cafeteria and I've got my child with me, and they all of a sudden start choking and you walk by. Okay?
In the cafeteria, with your child, all of a sudden starts choking and I walk by.
Yeah.
Okay, is it safe for me to approach?
It's safe for you to approach.
Okay. So, Mom, are you okay? Is your baby okay?
My baby's choking.
Okay, is baby, you can see they're responsive, they're conscious.
So baby is trying to cough, but it's ineffective.
Okay, all right. Help, I need some help.
So help is coming. Call 911.
Okay.
Still nothing. There's the fishbone.
Oh, nice.
Well done.
Okay.
Okay, so we'll do that again,
Okay.
but now with stage 2. So slowly. So same scenario.
Okay.
Okay.
So, is it safe for me to approach?
It's safe for you to approach.
So I come and I assess responsiveness, consciousness level, as well as effectiveness of cough.
So cough is, baby's conscious and the cough is still ineffective.
Okay. So I ask for help. Help, please. Help is on the way.
Help is on the way.
This is a bigger child. One of the maneuvers I could be seated. Hands away from soft tissues, holding the mandible as before. Head down, prone position, and I proceed to deliver back blows. Each blow is designed to dislodge the foreign body. That doesn't work. I'm going to deliver abdominal thrust. Fist in one hand, one of my fists in between the umbilicus and the sternum. Pressure, and I'm going to give sharp thrust upwards and inwards. 1, 2, 3, 4, 5. If this doesn't work, I quickly assess consciousness, letting the cough, the foreign body is out. If it's not, I proceed once again, prone, head down, and deliver back blows again. 1, 2, 3, 4.
There it is.
And then